In this video, we're going to reveal the key signs that you're dehydrated without even realizing it. Watch until the end so you can spot these red flags before they lead to bigger health issues. If you find this video helpful, be sure to like the video and subscribe for more health advice. When you're dehydrated, one of the first noticeable signs is a persistent dry mouth. Saliva plays a crucial role in maintaining oral health, but when your body lacks sufficient water, saliva production drops. This leads to a consistently dry, sticky feeling in the mouth. The absence of moisture not only creates discomfort, but also allows harmful bacteria to thrive. Normally, saliva helps wash away food particles and bacteria, but when there isn't enough saliva, these bacteria accumulate, resulting in bad breath. The connection between dehydration and bad breath is straightforward. Without enough saliva, bacteria break down more proteins in your mouth. This breakdown releases foul-smelling sulfur compounds, which are responsible for unpleasant breath. Often people mistake this as simply a need for better oral hygiene. But no matter how often you brush or use mouthwash, the bad breath won't fully disappear if the underlying issue of dehydration isn't addressed. Dry mouth can also affect your sense of taste. You may notice that food doesn't taste as vibrant or flavorful as it usually does. This occurs because a dry mouth hampers the normal functioning of your taste buds. Saliva acts as a medium that helps dissolve the chemicals in food, allowing your taste buds to perceive flavors. Without adequate moisture, your ability to taste diminishes. This subtle change in how food tastes is another overlooked sign of dehydration. Dehydration doesn't stop at causing a dry mouth and bad breath. It also impacts your overall oral health. When your mouth is consistently dry, the risk of tooth decay and gum disease increases. Saliva helps neutralize acids produced by bacteria in your mouth, protecting tooth enamel from erosion. Without enough saliva, your teeth become more vulnerable to cavities, and your gums may start to recede or become inflamed. Muscle cramps are one of the less obvious but significant signs of dehydration, often catching people by surprise during even mild physical activity. When your body lacks sufficient hydration, it struggles to balance electrolytes, including sodium, potassium, calcium, and magnesium. These electrolytes are essential for proper muscle function and contraction. Without enough water to transport these electrolytes to your muscles, the delicate balance is disrupted, leading to painful involuntary muscle spasms or cramps. Dehydration affects muscle performance because water serves multiple roles in muscle function. First, it helps transport nutrients to your muscles and remove waste products such as lactic acid that accumulate during movement. Without enough water, this waste builds up, making muscles more susceptible to cramping. The reduced blood flow due to dehydration also limits oxygen delivery to muscle fibers, further contributing to cramps during even the lightest of physical activities, like walking or stretching. Another factor linking dehydration to muscle cramps is how water helps regulate your body temperature. As you move, your body generates heat, which it releases through sweat to cool down. Sweat, however, isn't just water. It contains valuable electrolytes that are lost when you sweat excessively without replenishing fluids. As dehydration progresses, your body's ability to cool itself diminishes, and this combination of fluid loss and heat can lead to muscle cramping, particularly in warmer environments. Interestingly, dehydration-related muscle cramps are not limited to specific muscles. They can occur in your calves, thighs, hands, or even the arches of your feet. The cramps often strike unexpectedly, sometimes even after you've stopped exercising, as your muscles remain tense due to the lack of fluids and electrolytes. People often dismiss these cramps as minor, assuming they result from a lack of stretching or overexertion, but they are frequently rooted in poor hydration levels. It's also essential to recognize that dehydration can exacerbate existing conditions like tight muscles or poor circulation. If you're prone to muscle cramps or have experienced them during mild activities, simply drinking water might not suffice. You will need to focus on restoring your electrolyte balance by consuming fluids rich in electrolytes such as sports drinks, coconut water, or electrolyte supplements. Dehydration can significantly impact both physical energy levels and cognitive function, often resulting in constant fatigue and a sensation known as brain fog. Many people overlook these symptoms, attributing them to lack of sleep or general tiredness, when in reality, a simple lack of hydration could be the root cause. Water is essential for maintaining optimal bodily functions, and when you're dehydrated, your body and brain both struggle to perform at their peak. One of the reasons dehydration leads to fatigue is its effect on blood circulation. Blood is made up of about 50% water, and when you don't drink enough fluids, your blood volume decreases. This forces your heart to work harder to pump blood throughout your body. As a result, you may feel sluggish, even after minor physical exertion. The reduction in blood flow also means less oxygen, and fewer nutrients are being delivered to your muscles and organs, contributing to that overwhelming sense of tiredness that seems to come out of nowhere. On a cognitive level, dehydration affects how efficiently your brain functions. Water plays a crucial role in delivering essential nutrients to brain cells and removing waste products. When your brain is deprived of water, these processes slow down, leading to mental fatigue. Brain fog, characterized by confusion, forgetfulness, and difficulty concentrating, is a direct result of this impaired cognitive function. Studies have shown that even mild dehydration, just a 1 to 2% decrease in body water, can negatively impact mood, memory, and overall brain performance. Dehydration also affects neurotransmitter function. Neurotransmitters are chemicals that help transmit signals between nerve cells, enabling you to think, feel, and act efficiently. When your body is dehydrated, the production of neurotransmitters slows down, further contributing to that groggy, unfocused feeling. This can make even simple tasks feel mentally exhausting, as if you're working through a mental fog that won't lift. Fatigue from dehydration can also be compounded by other symptoms such as headaches and dizziness, which are common when your body lacks the necessary fluids. These headaches occur because dehydration causes the brain to temporarily shrink from fluid loss, pulling away from the skull and triggering pain. The reduced fluid levels also mean less protection for the brain, making it more sensitive to pressure and discomfort. One of the most visible and reliable indicators of dehydration is the color of your urine. When you're well hydrated, your urine will typically be pale yellow or even clear, which is a sign that your body has an adequate amount of water to perform its necessary functions. However, when you're dehydrated, your body works to conserve water, and as a result, your urine becomes more concentrated with waste products. This leads to darker, more intense shades of yellow, sometimes even approaching amber or honey in color. The color change occurs because urine contains a pigment called urochrome, which is a byproduct of the breakdown of hemoglobin in red blood cells. When your body is well hydrated, urochrome is diluted with plenty of water, giving your urine that pale or clear appearance. However, when dehydration sets in, your kidneys retain more water to prevent fluid loss, concentrating the urine and making the color more intense. Dark yellow urine is not only a sign of dehydration, but also an indication that your kidneys are working harder than usual to conserve water. Normally, your kidneys filter out waste and excess substances from the blood, which are then expelled as urine. When you're dehydrated, the kidneys hold on to more water, making the urine more concentrated with waste, electrolytes, and minerals like sodium and potassium. While this process helps maintain the body's fluid balance, it also means that the waste is expelled in a smaller volume of fluid, leading to darker urine. It's important to pay attention to the timing and frequency of your urination as well. When you're adequately hydrated, you'll likely urinate every few hours, and the volume will be higher. In contrast, dehydration leads to less frequent urination, and the volume will be smaller, with a more intense odor due to the concentration of waste. If you notice a strong, pungent smell accompanying your dark yellow urine, this could be another sign that your body is dehydrated. In more severe cases of dehydration, urine can even take on a brownish hue, resembling cola. This could indicate not just dehydration, but also potential kidney strain or even damage, as the kidneys are pushed to their limits trying to retain water. At this point, rehydrating becomes critical, as prolonged dehydration can lead to kidney stones or urinary tract infections due to the high concentration of minerals and toxins. Your skin is the largest organ in your body, and like every other organ, it depends heavily on water to function properly. When you're dehydrated, one of the more visible signs is dry, flaky, or less elastic skin. While many people associate skin dryness with external factors like weather or skincare routines, dehydration plays a major role in your skin's appearance and health. Skin is made up of cells that require water to stay plump and hydrated, and when your body lacks sufficient fluids, these cells lose moisture, causing the skin to become dry, rough, and less vibrant. Dehydration affects the skin's ability to perform its essential functions, one of which is regulating body temperature through sweating. When you're well hydrated, your body releases sweat to cool down, especially during physical activity or in hot environments. However, when you're dehydrated, your skin doesn't sweat as efficiently. This not only affects your body's cooling system, but also strips the skin of its natural oils, exacerbating dryness. In addition, dehydration diminishes your skin's elasticity, a quality referred to as turgor. This can be tested by gently pinching the skin on the back of your hand. In a hydrated body, the skin will snap back into place quickly. However, in someone who is dehydrated, the skin will return to its original position more slowly, indicating a lack of moisture in the skin cells. This slower return is a key sign that your skin is not receiving enough hydration from within. Dehydration also impacts the skin's barrier function, which is responsible for protecting against external irritants and pathogens. The skin barrier relies on a combination of lipids and moisture to remain intact and resilient. When you're dehydrated, this barrier becomes weakened, leaving the skin more susceptible to irritants, allergens, and bacteria. This can lead to inflammation, increased sensitivity, and even conditions like eczema or psoriasis flaring up more frequently or severely. Another effect of dehydration on the skin is a dull or tired appearance. Proper hydration helps maintain blood flow to the skin, giving it that healthy, glowing look. When you're dehydrated, blood circulation slows, which can cause the skin to appear pale, tired, or even sunken. Dark circles under the eyes may also become more prominent, as the thin skin around your eyes is particularly sensitive to fluid balance. Thanks for watching. If you found this video helpful, make sure to give it a thumbs up and subscribe for more health tips. Don't forget to click the video on the screen to keep watching more content that'll help you stay on top of your health.